Hello and welcome everyone. It is 11:30 Central, so we will get started. Thank you for tuning in to today's webinar, Transforming Health Science Lessons with Scenarios. My name is Kelsey and I will be your moderator for today. First, here is your 30-second introduction to Realityworks for those of you who aren't familiar with us. We are an employee-owned company based in Eau Claire, Wisconsin that creates experiential learning tools for teaching job and life skills. We got our start over 20 years ago when former NASA engineer Rick Germain created the first RealCare Baby infant simulator and then went on to found the company that is now Realityworks. Today, our training tools combine curriculum with hands-on learning tools, student activities, and assessments. Baby is still around, but now you can look to us for our tools like bovine birthing and ultrasound, our virtual welding simulator, our wearable geriatric sensitivity suits, and if you have some time, we encourage you to check out our website and see it all. Co-presenting today, we have Emily Kuhn, who is the Senior Campaign Specialist at Realityworks for over 10 years. She collaborates with educators and administrators to understand how they are implementing Realityworks products and programs into their schools. Emily is a frequent presenter on topics regarding soft skills and student engagement at education conferences, webinars, and professional development. We also have a guest speaker, Karen Edwards, who is the sports medicine instructor at Chapin High School, who will be sharing how she uses scenario-based learning in her classroom later on in this session. Before we get started, I want to cover a couple things. First, today's presentation is being recorded and all attendees will receive a link containing the recording, as well as a copy of the PowerPoint slides and free resources. For those of you attending live today, you will also receive a certificate of completion for attending today's presentation. Keep an eye on your email. You will receive that email within 24 hours after the presentation, and we will have time at the end for Q&A, so feel free to type your questions in the chat or Q&A feature located at the bottom of your screen. With that being said, I'm going to go ahead and pass things over to Emily.
Awesome. Thanks for that introduction, Kelsey, and welcome everyone, including Karen. Super excited to hear from you later on in today's presentation. Today we have four main objectives for our time together. First, we are going to dive into understanding what scenario-based learning is and how it can be used to enhance student engagement and comprehension. Next, we'll explore ways that you can integrate this type of learning method into your own classrooms. And of course, that will include hearing from Karen Edwards on her experience using this type of teaching method. We are also going to take a closer look at some of Realityworks tools that can support you in implementing scenario-based learning, particularly through our Medical Mannequin Quick Scenario Set, which is designed to simplify and enrich your classroom. Hopefully, by the end of today's session, after we share all of this information, our goal is to have you walk away with actionable insights, practical strategies, and some inspiring examples for transforming your teaching method. So with that, let's get started. So we're going to kick things off by chatting a little bit about what is scenario-based learning. Well, in the simplest of terms, scenario-based learning is an active learning strategy that uses stories or patient cases as a way to immerse students in real-life situations. The goal is making those learning experiences engaging and memorable. So we'll take time today to examine normal teaching practices and how it's possible to use scenario-based learning in a way that's logical, intentional, and appropriate. Understanding this structure is key truly to identifying the right times and places to incorporate this specific type of teaching method. So for the theory junkies out there, this method of teaching has been widely proven to be effective, and especially effective in the health sciences when real life practice for students is not always an option, due mainly to safety issues. Here are some sources for you if you'd like to dig in further. And as a reminder, as Kelsey shared, everyone will get a copy of these slides following today's presentation. So if you need to take any notes, you'll have access to all of these slides and links. So let's begin by taking a look at how we normally teach students, beginning with the foundational establishment of facts. The foundational establishment of facts is the heart of everything. Without facts, without factual knowledge, we can't expect our students to succeed in health science. Consider this factual knowledge to be the bottom row of our house of cards, as you can see on the image on your screen now. Whoop, as I'm scrolling too fast. Next would be the second level would be to add some context so that students can begin to learn how these facts apply to real life. Give them opportunities to think through different scenarios and recognize the consequences of their actions, both correct and incorrect. Now, this may include discussions with other students, discussion postings on your course website, or written responses. But this added context really gives students a taste of what situations they might encounter in their future practice. Being able to visualize the connections between their activities in school to what they'll be doing once they get that job provides real relevance for students and as a result increases their engagement. It helps them understand why they are doing these activities in school. The key here in that stage is that the student has time to think through their choices, change their minds, and even course correct. This would be that middle level of that house of cards image. And then, of course, there's the highest level, which is the ability to take the facts, remember how they've applied those facts in the past, and then act on what they have learned right then in the moment. So a simple non-health science example of this would be learning to drive a car. Before we ever let someone climb behind the wheel, as we all know, they're expected to pass a written factual exam that tests on things like the rules of the road, right? That's level 1. So now you've passed your factual exam and you're ready to start applying those rules. You might have some behind the wheel actual training where, say, an instructor is right behind you or beside you in, say, a simulated driving environment, and you can practice applying the rules of the road in this less stressful situation with time and opportunity to course correct until you get it right. That would be the middle level of your house of cards. The highest level then is when you're tested in real time to see if you can apply your knowledge to the rules of the road. Have you mastered the content? Can you be safe? We expect, of course, for the safety of everyone, for people to know and follow those rules of the road, and it's the same in health science. The point here with all of this is that you can see if one of the levels is lacking, then that house of cards is going to fall down. We're going to crash that car, and something, in the case of health sciences, something could happen to the patients. So back to that foundation of facts, that first level of the house of cards. A test question might be, what's the normal oxygen saturation level for a healthy adult? Now, this type of question is simple fact regurgitation, but it's necessary to establish baseline understanding for students. Now, classrooms are structured at this level to be able to answer those fact-based type of questions. This is not the right time for incorporation of scenario-based learning. However, once you've established that your students know certain facts, then you can ask them to begin to apply those facts to real life situations, and you can do this through context. Some examples of adding context could be written case studies, discussion board postings, small group or parent share conversations, and large group discussions. But you can get really creative here. You can post a video on your class website that students need to respond to. You could ask that they upload a video response to a scenario. This is an opportunity to let your creativity show here and try new things. So now we move to the highest level on that house of cards example, the actual driving of the car. And here, actually, it might be where this car driving analogy ends, because in health science, we still have determined that students aren't ready to be let loose on the streets without more practice and supervision. So instead, this highest level of the house of cards actually happens when they're still in school. You often use simulation or role-playing activities at this level. And again, this is an opportunity to be creative. Have your students record a video demonstrating their abilities in real time, for instance. These types of activities require students to build on that foundational knowledge, use what they've learned when they've had practice, and intervene with simulated patients all in real time. This is when instructors can implement a scenario for students to actually do, and you know what you're looking for them to do. As instructors, you have expectations for the actions that, to you, will demonstrate that your students have all of the knowledge that they need. So why so much detail about these various levels of learning and our house of cards? Well, it's really to paint the picture to understand that scenario-based learning is not one discrete activity. It's an umbrella of types of activities that can meet your teaching objectives. It's also to determine that there are times and places for scenario-based learning, right? In our house of cards, scenario-based learning isn't necessarily used at that foundation of fact stage, that bottom row, but it's used in both of the two highest levels in different ways. So let's dive into some tips for making the most of scenario-based learning in your classroom. I have 5 tips listed here, and we'll talk about each one separately in the upcoming slides. So tip number 1, consider what elements you need to include. If you're writing your own cases or your own scenarios, what elements do you need to include for it to truly be scenario-based? Well, the first is context. The crux of this is to provide enough detail for your students to understand the situation they're being placed in. If you're trying to figure out if you have too much detail or not enough detail, have one of your teacher colleagues work through your scenario-based learning activity. It doesn't take long, but having that fresh set of eyes on your work will help inform any revisions you should make before trying out your activities with your own students. The next is decision-making points. Even with appropriate levels of detail in your context, if the student is not required to decide anything, the activity will seem pointless and you'll lose their engagement. The context should adequately set up your situation, and then your next step should be to figure out what students should do. And that last component that should be present for all of your scenario-based learning activities is clear learning outcomes. Of course, you already know this. I'm sure you're used to developing learning outcomes and have them guide what and how you teach. But it always bears repeating that these objectives are your North Star. They help keep you moving in the right direction. So tip number 2, if you're questioning whether it's appropriate to use scenario-based learning in a certain situation, well, good rules of thumb to answer this question are only after foundational knowledge has been established. If you introduce a scenario before your students have the basic levels of knowledge or skill, that first row in the house of cards, your students will end up confused and frustrated. Use scenario-based learning when you want to examine students' decision-making capabilities. Have students practice verbalizing how and why they make decisions the way they do. Doing this can help support the correct decisions they make and can really help redirect when they're heading in the wrong direction. Now, there are two options for which scenario-based learning can easily be used in, and there's great value in both. First are the instances where you can't guarantee that all students will experience, say, in a clinical setting. And the other great opportunity for the use of scenario-based learning are the situations that students will often see in their professional practice. In both of these cases, you want to ensure that your students can show mastery before they go out into the real world. Tip number 3, should you create your own scenarios or should you purchase ready-to-use ones? Well, the answer is really either or both together. Creating your own scenarios, of course, can be incredibly time-consuming. But the positive side is that you will have scenarios that are tailored exactly to your course content and your learning objectives. Now, if you choose to purchase, obviously you're spending money, but the convenience of ready-made scenarios can really lighten your planning load. And if you go this route, make sure you review the cases to make sure they align with your desired outcomes. You should always feel free to tweak ready-made scenarios to meet your own objectives more closely. Tip number 4, consider a mix of media. Scenario-based learning does not always need to be a written case study or a full-blown high-fidelity simulation scenario. Consider small steps to mix things up. If you're introducing a patient case that would otherwise be written, for instance, could you record a fake audio of that quote-unquote patient delivered in first person to help students get to know them better? And with that audio recording, could you find a fake picture to go along with the message? Students today, as you already know, I'm sure, are so tech savvy. Can you ask them to video a response to a scenario instead of writing their responses down? Or could you record a video to introduce a scenario? These options don't need to be movie quality. Using your cell phone is more than enough to get your point across in a way that draws students in. This will help grab and keep their attention. Our final tip, tip number 5, is really to just be patient with the whole process if using scenario-based learning is new to you. Some activities will be a home run the first time you try them, and some will be complete flops. Most will fall somewhere in the middle. Your students learned, they were engaged, but some detail here or there could be improved. Just keep evaluating what you're doing in the classroom. And be patient with your students as well, especially if scenario-based learning is new for them. It can take a couple of tries for it to feel less awkward or uncomfortable. But they'll soon see how much more interesting it is to be actively involved rather than listening to the sage on the stage. So with that, we're going to turn things over to Karen Edwards, who again is the health science sports medicine instructor at Chapin High School. Welcome again, Karen.
Thank you so much for having me today. I do just want to share with everyone how I use some of the scenario-based instructions in my classroom. I teach both sports medicine, health science, and medical terminology, and I use scenarios in all three of my preps. I want to share with you 4 teaching methods that I incorporate and use in each one of my units, from modeling, problem solving teaching, metacognitive strategies, which sounds way more complicated than it actually is, and Socratic seminar, which can be scary, but it's okay. I want to share with you a quote from John Hattie, and I'll be referencing his effective models just to kind of build off of what Emily has already shared. His quote states, across the grades, when instruction was challenging, relevant, and academically demanding, then all students had higher engagement and the teachers taught to us, which is a great benefit. And the best beneficiaries were the at-risk students. And again, that comes from John Hattie. Next slide. So the modeling technique, and Emily has already kind of mentioned this, but the effective size from John Hattie says that it's a 0.75, which in his mind means that if we were to use this type of instruction, whether with case studies or with other things, then students would almost skip a grade level by the end of the year within our field of content, which is huge. He says that anything at a 0.4 or to a 0.7 is good, and anything from a 0.7 and above is absolutely amazing. Oh, he didn't quite phrase it that way, but that's how I phrase it. With modeling, you want to be clear and concise so they can follow your train of thought. When I use scenarios and I'm modeling this, it's really at that introductory level where they are learning how to walk through a scenario. I use a case study from either personal experience or one where you can definitely explain the entire scenario answers, and I walk them through it. Here's a picture of me with a baseball team that I covered in the summer. It was one of these freak kind of accidents in the way he got hit by the pitch. And I walked them through it. This was how I went out to the plate. These were the questions that I asked. Here were his answers. And we walked through some of the knowledge that they've already been introduced to in the unit and asked them then, okay, what do you think I should do next? Well, this is what I did. And I modeled them my thought process. With scenarios, like Emily said, students may not know how to work through them at first. And so you have to show them how to do it. Clinicians are saying time and time again, and nursing students, medical students, and all across the board, they don't have that critical thinking aspect as much. Next slide. Problem solving teaching. And this is where them not having the critical thinking aspect comes into play. And this has an effect size of 0.68, which is still pretty good. Again, modeling what you expect of them, giving them the problem, and then instead of you discussing it with them, allow them to discuss it with each other. Allow them to struggle. I put a picture there of a mom mowing the grass. I think as teachers, we have all experienced the lawnmower parent now, where they just want to come and get rid of anything in their kids' way. As health science instructors and sports medicine instructors, we know that they're going to come across things that parents can't get rid of. They're going to have difficult cases. They're going to have difficult athletes, difficult patients, difficult people that they work with. and they have got to struggle to find that way of either finding the diagnosis or finding a way to work through the problem. Then, just when you think they're going to throw the books across the room, you intervene. With this, it's a way to still be there for them, but allowing them to really feel the need to learn it on their own. Next slide. The metacognitive strategies, and this is one of my favorites because even though it's a 0.6 and not a 0.7, I can use this as a bell ringer, which who would have thought you use case studies as bell ringers? But when we've been in the unit for a couple of days, they have that foundational knowledge, like Emily has already mentioned. They start to develop that awareness of their own learning. I give them a case study. As soon as they come in, it's either posted to our learning management system or it's up on my whiteboard. I give them 2 to 3 minutes to walk through parts of the case study on their own. They then pair up. I have groups of 3 in my room. With that group of 3, they then talk about it. Then we share as a class. What did you get? Did you get the same differential? Did you get the same questions that you were going to ask? If I have a short case study on an athlete who has sprained her ankles and had previous Achilles tendon injuries, and now she landed her bar dismount a little funny, she's injured her ankle again. What questions did your group think to ask? What are you thinking could be wrong? Is it a re-injury? Is it something new? Should we look at other things to diagnose? Are we looking at nutrition? And that allows them to get a little frustrated if they aren't where they need to be in their learning for that unit. It allowed them to consult with their peers before we talked about it as a class. 10 minutes. That allows me to take attendance, to see who has turned in work, and it also allows me the opportunity to see who really understands that unit. What do I need to go back over? So I love this strategy. Even though it sounds a little difficult, it's great. And I use this one often as a bell ringer or towards the end of class when I may be needing to do things and just see where their learning is. Next slide. Socratic seminar is amazing. This one takes a while to set up, however. The first one is the fishbowl method. That's where you have an inner group and the outer group is really looking in like a fishbowl to see how they're learning. How are they talking? Is everyone participating? To me, it's not as effective when I am setting it up. However, I love the circle of paired chairs. This one, I definitely use pre-made scenarios. And the reason for that is because the questions that come with those scenarios, I don't have to delve into it. And it doesn't take as much time for me to think through. I do this versus direct instruction on days when we are further into the unit. I have an inner circle paired with an outer circle. I give them a minute for the inner circle to discuss the question, the first one. Then the inner circle will rotate, be paired with a new person, and now they discuss the second question. So they're still kind of discussing different questions as they go. It's weird at first. Kids don't like it. They are awkward in their learning. Teachers may be awkward in theirs as well. But this is a way for that scenario to now hit multiple people, not just their group of 3, and not allowing 1 or 2 students to hide in the back of the classroom and not answer anything. You have to have some sort of discussion at each stage of the scenario. This is going to be a more complicated one that I would definitely use at the end of the unit for review. And I only use this one maybe once or twice a quarter. These are just some of the ways that I use the scenarios. again, I do love this because, like Emily said, it's either going to allow them the opportunity to hear things that they may or may not see in their clinical experience, or to get a lot of practice with something they're going to see often, like vital signs coming in, scenarios of hypothermia. We have a snow day right now. I definitely had my kids for their e-learning go over hypothermia because I'm pretty sure a lot of them went outside without gloves and then saw their red little fingers. So, next slide.
Oh, oh, you know what?
Yeah,
This was the last one we had from you. Did you have another
yeah.
one?
No, I was just going to say if they have any questions at the end of the webinar, they are more than happy to ask me any questions about the scenarios that I do use.
Awesome. Thank you for that, Karen. That's great. We'll be sure we can share your contact information as well if you're comfy in our follow-up emails.
Definitely
That information was
comfortable.
great. Awesome. Thank you. I especially liked the lawnmower parent analogy, I have to say. That was fabulous. Well, we are going to wrap up today's presentation by taking just a quick look at a few of the tools Realityworks offers that could help you use scenario-based learning in your classroom. I mentioned this in the beginning. Our shining star for this particular topic is our medical mannequin quick scenario set. This is one set of over 100 ready-to-use scenarios, and they truly cover a breadth of content from pediatrics to adults to geriatrics. There are skill-based scenarios. There are scenarios that emphasize soft skills like communication. There's a huge variety in settings, including clinics, inpatient settings, outpatient settings, community sites. And the really cool thing about this particular set is that the scenarios each include clear objectives, student roles, setup instructions, pre-briefing questions, those simulation scenarios with expected student actions. They're all laid out for you. They follow the INACSL standards of best practices, so you can be assured of their quality. And you get 5 sets of scenario cards, so you can creatively use those in smaller groups, maybe for bell ringers and printable workbooks and all. This is an awesome set. We specifically made this so you can grab and go. And of course, you can tweak these scenarios as you see fit to make sure that your own course objectives are met. If you find yourself short on time, but really motivated to start using scenario-based learning in your classroom, we'd love you to visit our website. There's a link on your screen. You can learn more if you wish. One additional really easy to use tool that we offer are our scenario cards that address many different areas of focus. The cool thing about these scenario cards is that they cover a variety of soft skills within specific career paths like nursing, medical assisting, sports medicine, EMT, and dental. We also have sets that focus on global skills like employability skills and leadership skills. If you have colleagues that teach in other pathway programs, even like agriculture and trades, we have them covered. But these are great. Again, those bell ringer activities. If you've got yourself, all of a sudden you find yourself with 5, 6, 7 extra minutes in a class and you want to pair your students up or facilitate any sort of large group or small group discussion on skills. These scenario cards are really fun to just whip out and give your students something to do that will put them in the context of situations they will likely encounter in real careers because every scenario in these card sets were written by real professionals out there in the world doing it. So again, if you want to learn more, there's a link on your screen that you can use to take a peek at these. Finally, last but not least, I just wanted to share some free assets. Everyone loves free assets, and we have some great ones you can take advantage of. The first is a blog that covers some additional tips for implementing scenario-based learning in a specifically health science classroom. Plus, you can get 2 free downloads of patient scenario examples. The second free asset is a guide that we created. Again, a little bit of overlap from the content presented in today's webinar, but some great additional tips and tricks as well. You can access that guide for free on our website as well. And, just get a few more resources and teaching tips for your scenario-based learning toolbox. With that, I will turn things back over to Kelsey.
Perfect. Awesome. So while we wait for some questions to roll in here, if you are interested in helping or starting your own program, you can scan the QR code on your screen, and we are able to connect you with your local Realityworks account manager. You can get a free quote, ask questions, and more. So now we will jump into some questions here. So first question in regards to the medical mannequin quick scenario set. Are you able to use that with your own mannequins?
Absolutely. Yes, the scenarios cover a variety of options, and they're great with whether you've got students, whether you've got actual standardized patients, whether you've got mannequins, or whether you just have your own classroom. They're very flexible. We design them that way because we want you guys to be able to customize them to meet your own specific needs.
Perfect. And then another question is, are these scenarios helpful for secondary, post-secondary, or both?
That's a good question. I neglected to state that in my slide, but the answer is all. Again, they're customizable, so you can pick a scenario and keep it pretty simple if you've got a group of students who are just starting their learning career with regards to health science. Maybe you haven't covered a lot of the more complicated topics yet, or you can take that same scenario and add a little more context to it and a little more detail, and definitely utilize it with students who are more advanced, who are possibly that much closer to really getting out into the real world.
Perfect. All right. Well, that is all the questions I see at this time then.
Okay, awesome. Again, we will share the slides with links with everyone who attended today's webinar, so keep an eye on your inbox. And we certainly appreciate everyone taking the time to attend, and big giant thank you to Karen Edwards as well. Awesome information that you shared today. I know we all really appreciate it. Thank you so much.
Oh, Emily, we do have one more question that just snuck in.
Awesome.
So this question was, how do you encourage students who are hesitant to participate?
Ooh, that's a good question. Karen, if you're on, do you have
Yeah.
any more recent experience with that particular scenario? I can envision that exact thing happening, probably quite
So
regularly.
I do have some students who are very hesitant to participate at first. And I think in the classroom for me, those are going to be my students who have IEPs or 504s for anxiety or other learning, um, not disabilities, but just learning challenges. I am more than happy to show them how I fail at times. I think that's one thing that our students are so afraid of doing, especially those who have anxiety. They are afraid to be wrong. And I show them that it's okay. And I encourage them to be wrong within the classroom prior to like a formal assessment. The reason for that is I want them to know that in the classroom setting, they're not going to kill a patient. When they go out in the real world, if they make that mistake because they were too afraid to be wrong in the classroom, that could happen. And I encourage them to do that. If they are still very hesitant, I love to attach some sort of incentive for the group that came up with the most inclusive answer. If it's asking, like for whatever question, or did you think of this differential diagnosis when we're looking at different scenarios? But just letting them know that it's okay to be wrong, I think, is the big thing. And I do that with the modeling. That's part of what Emily mentioned, showing them how to do the scenarios. And part of what I do as a teacher is showing them that, we've made mistakes and none of us were perfect. And we had those teachers that allowed us to do that before we got into the real world. So, and incentives, when they love a good candy or a Snickers. And if you're not allowed to do that, pick the next song that we listen to in class while we're doing independent work. Works well for me.
Sorry, I'm laughing a little bit because your suggestion of candy or a song choice is particularly fabulous. I think those are great tips. I appreciate that answer. Thank you. Hopefully,
It surprisingly it works. The high school kids love it, or stickers. You wouldn't think that they do, but they love it.
I
So.
love that. Awesome. Thank you for that, Karen. Any other questions, Kelsey? I see you just reiterated that everyone will get links to the slides and then of course our guide and free resources we shared as well. So keep an eye on your inboxes again. We will definitely share these resources. Anything else that you're seeing, Kelsey?
No, not at this time.
Okay, great. Well, again, thank you everyone for joining us today. We hope you learned something valuable. And have a good rest of your day. For everyone experiencing a snow day, stay warm. Thanks again.